Things to monitor when you are starting your prolonged fast for the first time. This is boiling down to two categories of symptoms: low blood sugar and electrolyte deficiencies. That is pretty much it. When you are prolonged fasting and you are starting this for the first time, those are the two categories of symptoms that you're going to want to look out for, that you're going to want to pay attention for and understand, and ultimately you would like to prevent those situations from ever becoming an issue. So we've talked a lot about electrolytes, so we're just going to go through that one again. So once you are fasting for more than 18 hours, it is per protocol to take the electrolyte supplements as well as additional sodium. And you'll do that every single 24 hours. So you'll do that twice if you're fasting for 48 hours. The broad spectrum electrolyte product, as well as an extra 1/4 teaspoon of salt per day, Himalayan or Celtic. Now, you can take the regular electrolytes as well, and many people do every single day because you're doing your daily intermittent fasting too as well. That's totally optional. If you feel better, I take a scoop of electrolytes every single morning when I wake up. That's just what I do. Can't say that I honestly necessarily notice a difference, but I do it anyways. I haven't made electrolytes per my protocol for essentials yet, but I would say over the last year started taking them every single day myself personally. Almost like an extra insurance card in the morning. So that's optional for you guys. Now, the other category of potential symptoms is low blood sugar, okay? I've talked a lot about this. I've talked a lot about hypoglycemia, understanding what that looks like. Hypoglycemia, low blood sugar, can be a very serious medical condition. And so we should all know exactly when to call it quits during your long fast. Delirium, confusion, dizziness, severe exhaustion, right? It's one thing to be tired. It's another thing to be so exhausted that you feel like you can't move. Any of those symptoms, end the fast. And what I would also do is test your blood sugar during that time. It wouldn't be a bad idea if you start experiencing it, because I don't make it mandatory for you guys to all have a blood sugar monitor device. But if you are experiencing symptoms like that, then it wouldn't be a bad idea to go ahead and get a monitor. And then that way you can know what it feels like paired with what your blood sugar is at. It's a good kind of test to do and understand. So it wouldn't be a bad idea to pick up a cheap little blood glucose monitor from a local pharmacy if you are experiencing a lot of those symptoms. Because generally, as you've heard me talk about, guys, most of you will not experience much of those. Brain fog, tiredness, yes. That's the acceptable category of symptoms that I want you guys to push through as much as you feel comfortable pushing through. But the other symptoms that we just talked about, those are the call it quits. Those are the potentially dangerous. Those are what you want to be aware of. And unless you're diabetic, most of you won't experience that. Some of you might. And so if you are, you got to be comfortable with them. You want to be testing your blood sugar. You want to have a good idea. You want to know when to call it quits. And you want to slowly push yourself and progress through that.